Well, as the globe marks International Condom Day, focus once again falls on HIV AIDS prevention and education programs in the country right now. International Condom Day seeks to promote the use of condoms as a means of preventing unwanted pregnancies and sexually transmitted infections. Well, an initiative by the AIDS Healthcare Foundation, it is an informal observance celebrated in conjunction with Valentine's Day. The foundation distributed more than 4 million condoms in South Africa last year, while the government distributed more than 400 million. Well, Dr. Ramneek Ahluwalia is the director of the Higher Education and Training HIV AIDS program, and he joins us now from our Pretoria studios. Good afternoon, doctor, and thank you for your time on the PM News Desk.
No, thank you, Kirshni. It's always an honor.
All right. Well, millions of free condoms are distributed every year, and most of these do end up being wasted. And this is where it gets worrying, Doctor. We saw it emerge in the HSRC report last year, where we saw an increased number of young people having unprotected sex and getting infected. They do appear to be relying on ARVs should they become infected. Have we let our guard down a little bit here?
No, I totally agree with you. The HSRC study has clearly indicated that the condom use or condom use in the last sex has decreased tremendously, and I think that's a serious concern for us. But we also have to know that condoms, that HIV, yes, condoms are one of the best prevention methodology we have for HIV. But there are also many more effects that condom does for us. HPV, human papilloma virus, sexually transmitted infections. HPV is the leading cause of cervical cancers. So condom is just not HIV. Condom prevents sexually transmitted infections. Condom prevents cervical cancers. Condom is also now prone to prevent teenage pregnancies. We have a huge amount of maternal deaths that happens because of young women that becomes pregnant. So I think condom prevention is absolutely essential, and I think, yes, at times the studies have shown, and we've also seen at the grassroots, that it has decreased, and it's a worrying factor for all of us.
Doctor, let's talk about the condom distribution to vulnerable groups. We know this should be very well targeted. Who are these vulnerable groups in South Africa right now, and can they access the condom easily and conveniently?
Our young women between the age group of 15 to 25, that remains the highest on risk of HIV. Women are a threefold risk to men. Men have to take responsibility of wearing condoms. Women have to ensure that when they are having sex with men, ensuring that men do take empowerment of wearing condoms. Important, another very key group of population is people who engage themselves in multiple partnership. Very critically is people who engage men having sex with men. It's always been shown that homosexual men are actually 4-fold to 5-fold at more risk than heterosexual people. Our sex care workers. So I think this is an absolute critical population that is absolutely exposed to its first time sexual debut, that is young girls. And I think that is where we need absolute education for HIV, absolute education for condom that prevents HIV.
All right, we do have many education programs right now running on South African campuses, but research shows that the majority of men still do not always use condoms. And if we look at a country like Uganda, where infection rates have gone down, prevention campaigns only became successful when two things happened: when national and local leaders spoke openly about HIV and led the prevention campaign, and when about 30% of the adults were HIV positive, and so many people were actually dying that it was impossible for anyone to be untouched by the illness. How can we draw from that, doctor, to forge a way forward?
I think yes, absolutely. These are good practices that we need to learn. But there are also good practices as our nation has been performing. I mean, I can quote you two big leaders that I work very closely on grounds of how they have taken so seriously, and they have been passionate about moving from one province to the other, from one college to the other. Minister Matsualedi, I must quote him, and of course my own Deputy Minister Manana. Every month we have my own Deputy Minister moving from one FET to the other, asking young people to look into safe sex, using condom promotion. So yes, nationally we have a very strong political buy-in, a very strong leadership that's looking into it. Where I think we are failing is our community leadership. I think that's where we need to build it up. We need more community leaders to pick up this disease. More of the problems happen at the community level. A clear example is last year in Durban when we launched our family planning program, lots of young girls took intradermal implants, about 75, 80 of them on that particular day. But how do we translate that knowledge into Ladysmith? We have to use people in Ladysmith, our young educated people in Ladysmith who can become leaders. These are our community leaders. When they speak the Zulu of the slang, which is spoken in Ladysmith, they connect much faster in Ladysmith than I or any minister nationally will do. So I think what we need is community leadership buy-in. And I think one of the lessons learned from Uganda is how at community level, or other nations is how we can bring those leaders up. And I think that will be our change going ahead.
Thank you, Dr. Ramneek Ahluwalia on the PM News Desk. Thank you for your time.